You. Hi everyone, my name is Kirti and today we have our live session on facial injuries in road accident. Hello doctor, please introduce yourself.
Hello everyone, I am Dr. Abhishek Bhattacharjee, consultant maxillofacial surgeon practicing in Raj Hospital.
Doctor, we'll start with the basic question. What are the risks of facial injuries in road and traffic accidents?
See, the risk of facial injuries in road traffic accident are the major one because the face is the most prominent part and it is the part of the body which is in the front. So in any kind of accident happening in the road traffic, so most possibilities are there. Some kind of injuries are there whenever some road traffic accident takes place. So it is a very prominent area of the body of human body. So chances are too much for the road traffic accidents and facial injuries.
Right. And what should be done at first if someone has suffered from the road accident? Like what should be the first thing?
See, first of all, we have to see that whether the patient is conscious or not. What is the mental consciousness status of the patient? We have to see something what is called Glasgow Coma scale, but in the day-to-day life, people won't be recognizing it. Whether the patient. So the main thing is that we have to see that patient is conscious or not. If some bleeding area is there, we have to stop those areas so that blood loss is minimal. And the most important thing is that they has to reach the hospital as quickly as possible so that we can find out that whether some injuries, any other injuries are also there or not, including the facial injuries.
Right. Also, doctor, we want to know what are the facial injuries after an accident? मतलब किस type की injuries होती हैं?
Facial injuries that happens in road traffic accident, mostly nasal bone fractures are the most common fractures that we see because the nose is the most protruding organ that we see in the human face. Then we have zygoma, fracture of this cheekbone that mostly occurs because those are prominent part of the face. Other fractures like you have the lower jaw fracture, mandible fractures, then the upper jaw fracture, maxilla, then the orbital fractures also there, which includes the content of the eyeball. Sometimes the frontal bone fracture is also there in patients. So ये सारे चीजें जो बोन्स हैं ये सारे बहुत ही उभरे हुए रहते हैं फेशियल स्केलेटन में, तो ये सबसे पहले इम्पैक्ट इसी में पड़ता है, तो ये सबसे ज्यादा चांसेस रहते हैं फ्रैक्चर्स होने के.
And doctor, which bone face are at higher risk of injury, as in are there some bone face?
Yeah, see this all which bone I've already talked about, like the nasal bone, the zygoma. So these are have the highest risk of fractures because they will be the accident. They will the first thing that will be getting traumatized in all this kind of accidents.
Okay, so let's talk about the treatment, doctor. What are the treatment for the facial fracture?
See, in facial fractures, we have to see that whether the trauma is major or minor. We have to rule out that first. Sometimes when there is a minor trauma like abrasions over the face or little cut marks are there, so we can just go for the suturing and dressing can be done in those cases, which are very minor. But when we see a road traffic accident, those are mostly major cases that comes to us. So in those cases, we'll go for a CT scan first for the face, facial 3D CT scan we go, and so that we can rule out what kind of fractures are there in the face. So after going through the CT scan, we can see that there are many, if the facial bone fractures are there, so sometimes there are undisplaced fractures of the face, which are not that displacement does not take place and those bone parts are in their anatomical position. So in those cases, conservative treatment we can go for the conservative treatment. But if the fracture fragments are displaced or anatomically not aligned, so in those cases we have to go for open reduction and internal fixation. In which what we do is that we see the fracture site and we do plating of those sites with titanium screws and plates, so that again we realign those into their proper anatomic position that was previously before the accident. And we realign them and plate them and fix them so that we can get a proper alignment of the bones which was there previously.
Doctor, how long does the recovery to the face injury, मतलब कितना time लगता है इसमें?
Time mostly is if If you talk about the discharge of the patient when the patient is admitted from the surgery to the till the discharge, if you talk about something around 3 to 4 days it takes, but it depends on the type of the injuries that patient has sustained. If it is a very major one, so they might take a longer time, like 7 days also, 7 to 10. But it depends on the type of the injuries that he has sustained, and this.
Okay. And how do you overcome a face injury? मतलब आपको क्या करना चाहिए?
देखिए, जब इस तरह की इंजरीज होती है तो वही हम पहले सीटी स्कैन करके डिसाइड करते हैं किस तरह का फेशियल फ्रैक्चर्स है। अपनी जगह पे बोन्स पहले अपनी जगह पे ही है, सिर्फ माइनर से क्रैक पड़ा है या फिर बहुत ज्यादा डिस्प्लेसमेंट है उस जगह पे। तो अगर हम लोग इस तरह तो हम लोग उस हिसाब से चलते हैं। अगर मतलब फ्रैक्चर्स ज्यादा होते हैं तो फिर हम लोग उसको प्लेट करना पड़ता है। टाइटेनियम प्लेट्स या स्क्रूज जो हम यूज करते हैं उससे अपनी जगह पे लाते हैं, जो कि प्रीवियसली एक्सीडेंट से पहले जिस पोजीशन में थे उसी पोजीशन में लाके और देखते हैं कि जो पेशेंट है वो बाइट अच्छा से कर पा रहे हैं कि नहीं, बाइट कर पा रहे हैं, साथ में हम खाना वो खा सके। उस तरह से हम फंक्शनली भी हम लोग देखना होता है कि पेशेंट फंक्शनली भी पहले जैसा ही है। हम लोग के लिए खाली एस्थेटिक्स ही नहीं, साथ में फंक्शंस भी इम्पोर्टेंट है। अगर पेशेंट को चेहरा तो अच्छा मिल जाता है, लेकिन अगर वो खा ही नहीं पाए या फिर कुछ बात ना कर पाए या स्वलो ना कर पाए तो उसके लिए एक मेंटल भी उनके लिए एक ब्लॉक रहता है कि हम कुछ कर नहीं पा रहे हैं। तो वो दोनों चीजों को बैलेंस बना के चलना बहुत ही इंपॉर्टेंस रखता है। और जैसे अगर पेशेंट इनसे बचना चाहते हैं तो मोस्टली अगर टू व्हीलर्स वगैरह है तो टू व्हीलर्स में वो हेलमेट पहन के, दोनों ही राइडर और पीडियन राइडर दोनों हेलमेट रहना चाहिए। साथ में अगर कार में है तो आप लोग को सीट बेल्ट्स मान के ही जाना चाहिए। इस तरह से वो बच सकते हैं इन तरह के एक्सीडेंट से।
Doctor, can face injury cause brain damage?
Yeah, see, as I told you earlier also that like the frontal bone fracture, this part of the fracture, it is one of the part of the brain box of the skull that we know. So the brain is inside this frontal bone. So any injuries happening in this area can cause brain damage also. So there are high chances of brain damage also in this facial trauma injuries, and most of the time we have seen that brain injuries are accompanied with this facial fractures.
And what would be the 4 types of skull fractures?
See, in the skull fractures, if we go through, then we can see there are like open fractures of the skull. Okay, there are green stick fractures. Then there will be some which are called non-displaced fractures. So these are the type of fractures that we deal in day-to-day life.
And are they fatal? मतलब जानलेवा होते हैं?
जी, बहुत ज्यादा जानलेवा हो सकते हैं अगर हम उसे ट्रीट ना करें और एकदम सही समय पे डायग्नोज ना कर सके तो कोई भी जैसे फेशियल फ्रैक्चर्स होता है, मोस्ट ऑफ द चांसेस जो है कि द पेशेंट विल एस्पिरेट some content like vomit or the blood or some kind the tooth particles or the bone fragments. So they might take it inside and it may go block the airway. So there the airway compromise is a major thing that we have to rule out, and we have to see that the airway is not compromised in this kind of patients.
Also, doctor, can trauma to the face cause damage to the eyesight?
Yeah, as I've already told that like the orbit, that eyeball is surrounded by the bones of the facial skeleton that we can see. If you just see all those this part of the eyes are surrounded by the facial skeleton. So any part gets damaged, it will also damage the total area of the eyeball that the eyeball is containing. That area might get enlarged, might get shrunken. So it might happen. So any kind of injuries like bone fractures or anything that might get into the optic nerve or any kind in the globe also it can damage. So there are very high chances in the facial fractures that some kind of damage may also happen to the eyesight also. So we have to see that what kind of injury is there. So it is very important for a facial fractures being treated, because sometimes what happens, there is restriction of the movement of the eye also. You may see it, but the vision sight becomes decreased. If you cannot move your eyes as normally before the trauma, so sometimes you have to relieve the muscles of the eye so that the vision, the sight is like before. So always the vision is not a problem, but the area that you are seeing, that is also a very important thing.
Also, doctor, what is the extent of recovery from facial injuries?
See, if we talk about the recovery, I have already told that sometimes it may take 7 to 10 days also for the patient to get discharged. Or sometimes it might take a single day. It depends on the type of fracture that patient has sustained. And if you talk about the bone formation will mostly take something around 5 to 6 months. Actual bone formation that we see. But if we do a plating for the patient, so patient can start functioning like normal, like in like 7 to 10 days they will start.
Doctor, last question. Is it possible to gain the same form of face after the treatment as it was before the accident?
Yeah, 100% we can get back those things like the facial structure that we have previously. We can get those. Important is that we have to see about the function of the patient. Sometimes what happens that we may put the bones together, but the function is not proper. They might not chew. We just only plate that, and the chewing function is disabled. So if the chewing pattern is not right, whatever we have fixed, there's again gets played off because of the force of chewing is not that much, and they might splay off, and our surgery may get hampered. So in those cases, we have to see the function is also proper, along with the aesthetics we can get, but the function is also very important with the aesthetics of the patient. And we can get the normal face, facial structure, and facial form even after road traffic accident. But the main thing is that the treatment is very important, and how we treat the patient is very important.
Thank you, doctor, for the information. Would you like to end? कोई मैसेज देना चाहेंगे आप अपनी ऑडियंस को?
जी, मैं यही मैसेज देना चाहूँगा कि जितना हो सके आप अपने आप को सावधान रखिएगा रोड ट्रैफिक एक्सीडेंट से। जो मैंने पहले भी कहा, बाइक के गाइड करते हैं और साथ में जो पिलियन राइडर्स पीछे भी बैठते हैं वो प्लीज हेलमेट यूज करें। उससे आपको काफी डैमेज होने से बच सकता है, आपके फेस में भी, आपके ब्रेन को भी। तो प्लीज यूज कीजिएगा। साथ में जो कार में भी सवार होकर चलते हैं वो भी, जो आगे में बैठते हैं उनके लिए भी, और आजकल तो पीछे में भी बहुत जगह मैंडेटरी हो गई है सीट बेल्ट लगाना। प्लीज इन जो ट्रैफिक रूल्स है ये फॉलो कीजिए, और ड्रिंक एंड ड्राइव एकदम मत कीजिएगा, क्योंकि ये सबसे ज्यादा खतरा रहता है। तो यही मेरा मैसेज रहेगा सारे ऑडियंस को।
थैंक यू सो मच डॉक्टर।